right, well, good afternoon. We're here at Eagle Physicians in Greensboro, North Carolina, which is a multi-specialty independent medical practice and that serves the greater Greensboro community. We're here with one of their patients, David, and he has just experienced a innovative new way to test for hearing in the primary care setting. A product called Hearing Healthcare Pro that was developed by Dr. Stephen Levine, who's with us also today. From Connecticut. The company is headquartered there, and Dr. Levine is a private practice otolaryngologist and on the faculty at Yale, amongst other things. So, David, if we could turn back to you for a moment, is this the first time you've been tested for hearing in a primary care setting in your...
It is. My previous experience was with a hearing loss clinic. I went into a soundproof booth. We had the headphones as well. But nothing like today's experience. Today was much more casual, thank you, Dr. Levine, and very uninvasive. So it was very casual, just like coming in to get a physical or something like that. So I found it very interesting and a very learning experience as well.
Okay, and what were the results of your test? Did you get a chance to speak with the physician about your results?
I certainly did. Started off with a nurse who came in and actually administered the test for me, and using the tool here, which is, we're looking at the simulation right now, and this is an after result of what we experienced after the hearing test itself. So when I first walked in, came in just like a regular physical, came into the room, sat down, the nurse went over some instructions, put on some headphones, and really the instructions were really simple. Put on the headphones, red over right, right is red, and listen to some tones, hit a button, a single button, when you hear tones. And she walked out. So it wasn't complicated at all. The test began shortly thereafter. It was very obvious. I heard the tones, hit the button, and followed those directions. Lasted about maybe 5 or 6 minutes. Then she came in, took the headphones off, and came in with the device. I can't remember, what's the name of it, Dr. Levine?
Tympanometry.
Thank you.
So our handheld, yes,
right.
It's the other major component of the exam, which is a handheld tympanometer.
There you go. So she used that device, and it's very uninvasive as well. I don't see it here, but it's only about this size, rectangular box, has a little device sticking on the end, and much like someone who looks in your ear to see is it healthy looking, she put that against my ear, said there'll be a little bit of pressure, you hear, or feel a little bit of pressure, and that's about it. And exactly what I had, a few seconds on the left ear, a few on the right. She went back and forth, checked the information, and then this is what really blew me away, is the presentation to me, the patient, is this. So she showed me right here what I was hearing and what other people hearing. You can probably see my name here says worst ear right. So I got to hear what my right ear is hearing. And then I got to hear a regular voice. And the difference between the two was astounding. It actually lets people hear what I hear, and that to me is an amazing device.
So you can better appreciate your situation, and so can family members, perhaps, or other people that are involved in your life.
Absolutely.
Who may not have understood without this type of capability how things sound to you, how you hear.
Right. Not only can someone else who is not in my head hear what I hear, but it also enlightened me to show me and to give me an example of, hey, here is your hearing loss, point A, point B, and you're somewhere in between. You're exactly right here. So that to me was very, very educational, and it showed me that absolutely I do have some hearing loss, and there are some benefits further down the line. There's probably some improvements I can make, and this was a great way to show it to me.
Sure, that's excellent. Well, thank you so much for sharing all of that with us. And would you recommend this test to friends, family members, other, perhaps work colleagues?
Highly recommend. And I want to tell you, I walked in, we took the test today, had no idea we were doing this today, and I was so enthused, I said, can we do a video on this? Because I want to share this with other people, honestly. So that's how I feel. And the answer to your question, Brian, is absolutely I would recommend it.
Excellent. And how about recommending Eagle Physicians, or at least this clinic, if they were to adopt the technology on a regular basis? Would you steer people who are looking for perhaps for a new provider to Eagle?
Oh, there's no doubt about it. From a point of view of servicing the customer, the patient, it's a great tool. and I would highly recommend any practice to be involved in something like this. You're going to find one thing. You're going to educate your customer. They're going to know, your patient, they're going to know exactly, here's what's going on. They're going to take action. They're going to rely on the expert in that practice. And yes, absolutely, I would recommend it for any practice this is very uninvasive, very simple. And from a patient point of view, oh yeah, this is very, very, very rewarding for me personally.
And because it was very spontaneous and you weren't aware that the test was going to take place, it didn't impede on your schedule or anything like that. It was simple enough and short enough that you...
Absolutely, I couldn't say it any better, Brian. It was very simple, very quick, and in the end, I have much more knowledge about my hearing and where to go next.
Excellent.
Very nice.
Well, thank you so much, David. Appreciate you taking the time to share your experience.
It was a pleasure. Thank you for taking my opportunity. And Dr. Levine, thank you so much.